In fact, instead of cutting Social Security, we're going to expand benefits for those who are on Social Security, especially the lowest income people. Well, thank you very much for being here for what I hope is going to be a meaningful and important discussion. As a nation, we talk about a lot of issues, but one issue that we don't spend enough time on is the reality of life for senior citizens and veterans in this country. And by the way, here we are on Veterans Day, and I want to salute all of the men and women who have put their lives on the line to defend our country. We thank you very much. The truth is that here in Iowa and in Vermont and all over this country, as we speak, there are senior citizens by the millions trying to figure out how they survive on $12,000, $13,000, $14,000 a year Social Security. There are seniors who are lonely. There are seniors who are depressed. There are seniors, in fact, who are turning to a significant degree to alcohol and drugs to ease their loneliness and ease their pain. There are seniors in this country, and I know I've talked to many in Vermont and around this country, who cannot afford the prescription drugs they desperately need. And they are literally cutting their pills in half, which is not a good thing to do. So what we're going to do today is talk about the reality of life for seniors, for veterans, and then we're going to come up with some ideas as to how we can improve that situation. And one thing, let me be very clear about, is we got Republicans out there who want to cut Social Security, Medicare, and Medicaid. Talk to Mitch McConnell, and I will give McConnell credit for at least being honest and come forward and say, yes, we need tax breaks for billionaires, but we have to cut Medicare, Medicaid, and Social Security. We will never allow that to happen. In fact, instead of cutting Social Security, we're going to expand benefits for those who are on Social Security, especially the lowest income people. And we are going to make sure that everybody in this country has health care as a human right, not a privilege. Now, Donald Trump runs around the country saying that Bernie Sanders wants to destroy Medicare for seniors. I will not shock anybody here to tell you Donald Trump is lying. I know you're all shocked to hear that. That is the case. This is what we want to do for seniors and for the American people in terms of Medicare for all. Right now, if you are a lower income senior, the likelihood is that you are having a difficult time getting the dental care that you need. You have seen, and I have seen, seniors who don't have teeth in their mouth, which is not a good thing, unable to digest their food, may get infections because of poor dental care. Under Medicare for All, we expand Medicare to cover dental care, to cover hearing aids, to cover eyeglasses. All right? You and I have met seniors who simply cannot afford the hearing aids. Hearing aids are expensive. That's a fact. And many seniors cannot afford hearing aids. Think about being 85, 90 and not being able to talk to your kids, to talk to your friends because you can't hear what they are saying. We can do a little bit better than that in the richest country in the history of the world. All right? So here is what we are talking about in terms of healthcare. We are expanding Medicare to cover hearing aids, to cover dental care, to cover eyeglasses, and home health care. Home health care. You have talked to, and I have talked to, families where senior citizens wanted to stay in their homes, but they needed help doing some cooking or making the beds or just helping out with a bath or whatever it may be. But they can't get their help. They're forced to go into a nursing home. And very often that does not work out well. That's not what people want. They would like to stay home. So we're expanding Medicare to cover home health care. And by the way, under our proposal, Medicare for All, plan that I wrote, because we're going to take on the greed and corruption of the pharmaceutical industry, all right? And we will no longer allow them, in some cases, to charge the American people 10 times more for the same exact medicine being sold in Canada or in other countries. Under our plan, nobody in America will pay more than $200 a year for all the prescription drugs they need. And how do we pay for all of that? We pay for it by ending the profiteering that currently takes place. Last year, the healthcare industry, drug companies and the insurance companies, made over $100 billion in profit. You got that? $100 billion, charging us the highest prices in the world for healthcare and by far the highest prices in the world for prescription drugs. And they're going to take 1% of their profits, it's $1 billion, and they put it on TV ads in Iowa and around the country, and in magazine ads, telling you how bad Medicare for all is. Understand what this debate is about in terms of healthcare. It's not about healthcare. Nobody can defend a system in which we spend twice as much per person as the people of any other country, while 87 million are uninsured or underinsured, and 500,000 people go bankrupt every year because of medically related illnesses. Can you imagine somebody coming down, being diagnosed with cancer, having to deal with cancer, deal with heart disease, deal with Alzheimer's in the family, and then on top of that, family goes bankrupt because there's an outrageous medical bill that they cannot afford to pay. So we are going to pay for Medicare for all by eliminating the profiteering of the insurance companies and the drug companies and the incredible administrative waste because of the complexity of the current system. We're wasting hundreds and hundreds of billions of dollars a year because we have many, many thousands of separate health insurance plans. You got a $5,000 deductible. You got a $7,000 deductible. You got this, you got that, you got that. They're all different. It has to be administered. What our plan is pretty simple. You walk into any doctor you want. You walk into any hospital you want. You don't take out your wallet. You don't take out your credit card. It is paid for out of the general tax base. And because we do it in a progressive way, overwhelming majority of the American people will pay substantially less for healthcare than they are paying right now. That is called a civilized healthcare system in a democratic society. Okay, what I want to do now is we're going to open this thing up for your thoughts. I want to hear from you. Just talk from the heart. Don't worry about the 19 television cameras behind you. All right, just because, again, this is an issue. Whatever you say here today, mark my words, there are hundreds of thousands of people saying, yeah, that's exactly what's going on in my family. And let's talk about it. Let's see what we can do about it. So what I want to do is I have some folks I want to call on first, and then we'll open it up to anybody for your questions, your comments. Fred Trujillo. Fred is a veteran and Central Iowa Public Employees Council union member from Des Moines. Fred, where are you? Right here. Okay.
Good afternoon. I was privileged to serve in the United States Coast Guard for 4 years. Very proud of the service that I...
Hold that mic a little bit closer.
Certainly was very proud of the service that I was able to provide. The last 2 years, my primary job was to keep drugs from coming into the United States through the Chesapeake Bay up into Baltimore. Unfortunately, several small boat units like mine, the Coast Guard, the entire crews were killed trying to do just that. So we did lose people, and it was hard. Right now, I'm very fortunate. I'm a public sector employee with the city of Des Moines, have been for almost 30 years. It's a good paying union job, and I look forward to retiring in the very near future. The problem that I'm facing is I have pre-existing conditions. I have the VA bill to cover mine, but my wife does too. We both have Lyme disease, and it's very difficult and very expensive to treat. And I'm ready to retire, but we can't because my wife can't retire. She's probably going to have to work another 10 to 14 years in order to maintain health care so that she can live.
So you and your wife are both ready to retire after a lifetime of work, but you can't because you're both dealing with Lyme disease, which is a very serious illness. Explain to us the kind of medical bills or the issues you're dealing with for your wife or yourself in terms of Lyme's disease.
Lyme disease is not recognized by every state in the union. There's not a single doctor here that will treat us. We have to go to Missouri. We went down just for a routine examination. Being how our insurance didn't cover it, it was $1,800 for the two of us to be seen that day. That's out of pocket. And fortunately, you know, we do both have a good paying job and we had savings, but that's $1,800 that came out of our savings account. If we don't have insurance, the insurance does cover antibiotics, which is great. It's a generic $5 a month. That's very helpful. But there's so many other things that we need. Our eyesight changes tremendously, even over a 6-month period of time. So
Lyme disease impacts vision?
exactly. Mental acuity, physical abilities, body aches. My wife wanted to be here today. She's been in bed for the last 2 days. She just feels absolutely terrible because we started a new treatment. They told us that she would feel bad. She chose to. I chose not to. And she indeed has been feeling really bad. And not just physically, but it's just the mental part too. It's just taxing. We've both been fighting it for a better part of 12 years. And with little or no help here in Iowa, again, we have to go to Missouri or Wisconsin or Minnesota. The doctors here refuse to believe long-term exposure to Lyme disease is a constant struggle.
Fred, thanks very much for sharing that. Sue Bathke is a retired farmer who became an IT worker after her husband's passing. She is also a cancer survivor who was laid off while she was going through her treatment. Sue, where are you?
I'm back here.
Okay, thank you.
Thank you, Senator. He kind of told my story, but that's okay. As he said, when I graduated from college, I married my high school sweetheart. He was a farmer. It was in the early 80s, and we found ourselves in the midst of the farm crisis. Some of you might remember that. He took a job off the farm doing grain building construction, and he was killed on the job. So I had to kind of pick things up and decide what I was going to deal with the rest of my life. So I went back and I got a degree here in Iowa to be a computer programmer. And I went to work here in Des Moines and worked about 15 years. I was diagnosed with breast cancer in 2005. And we were very fortunate. I remarried. This is my second husband. And we were very fortunate at the time. I had very good health insurance. So honestly, I don't even really remember how much it cost, and I had a good job. So those were just things that really didn't impact our lives at the time. I could compare that to my sister who had gone through breast cancer herself 5 years earlier. She didn't have good insurance. And at the time, tamoxifen was extraordinarily expensive. I think the senator knows about this because he took some women to Canada to buy that drug. By the time I was diagnosed, the price had come down and there were generics available, so that was very helpful for us. Since after that period, I was continuing treatment, and in 2011, I was laid off. I was 55 years old, and we found ourselves with health insurance. We could go on COBRA, but it's twice as expensive, and you don't have an income. So that was really difficult, and so in the years since, I've kind of gone back and forth between being unemployed and doing IT short-term contract work. So you have insurance there and it changes all the time and you're always having to keep up with what's covered, what's not covered. And it's so time consuming and so frustrating. And I just really wish we had had Medicare for all when that happened. It would have been such an easier, when something like that happens in your life, it would have been easier to have that as a safety net than to just have to be out on your own trying to figure out where you're going to get health insurance because like they said, you have a pre-existing condition, you have to have health insurance. So that's kind of where we are right now. I'm unemployed currently. I do have a position coming up next week to start. And when I am unemployed, my husband will work at Walmart. A good part of that is because of they have health insurance and you can get on right away and things like that. So
what does it mean to be struggling financially and not to have the quality health insurance that you need?